Davis. As you know, I'm the family nurse practitioner that just did your assessment. I just wanted to sit down and talk a little more today about your diagnosis, our goals, and some of the different therapies that we can use to kind of help you. So today we measured you at 5 foot 3 inches and 210 pounds, making you have a BMI of 39. Are you familiar with what the term BMI means?
I am not.
Okay, so BMI is your body mass index, and it's a calculation using your height and your weight, and it's measurement of body fat. So obesity is technically defined as a BMI of over 30, and today yours was 39. So now that we know this, we have defined that you fall into the category of obese. So obese is an accumulation of body fat, and it can be around your hips, around your abdomen, and different spots in your body. Do you know what can kind of lead to obesity? Do you know some of the...
I feel like a lack of exercise.
Yes, good. So lack of exercise, diet, culture can play into effect, socioeconomic status, and genetics. Do you by chance have a parent that's overweight?
No.
Okay. So sometimes that can play into it as well. The problem of obesity is when you accumulate fat throughout your body. This can lead to alterations in different hormone levels and chemicals that your body produces. Have you ever heard the term triglycerides or insulin
No.
or cholesterol? Okay, so those are different hormones and chemicals in your body, and when you have increased fat accumulation, it kind of alters those levels, and that can cause some further complications. Do you know any complications that obesity can have on your health?
No, not really.
Okay, so have you heard of the terms high blood pressure
Yeah.
and diabetes,
Mhm.
stroke, and heart disease?
Yes.
Those are all major medical problems that you can kind of develop, or you'll be at a higher risk for if you have obesity. So today your vitals looked very good, which is very reassuring. But I would like you to get some further lab work just so we can check your insulin levels, your lipid levels, and some basic blood work to make sure that this hasn't gone, any farther. So I guess the big question is, what can we do? What can we do to get you healthy, to get you into a weight that you feel comfortable in? How do you feel hearing the term obese used for yourself?
I think that is something that would be surprising
Okay,
to anyone that has obesity.
yeah.
Like, you never really think you're obese. And it's not ideal.
Okay. So you're open to maybe doing some things to decrease your weight?
Yeah.
Okay. So what do you think, how many calories do you think you have to have a deficit of to lose 1 pound of fat?
100 calories.
Okay. So it's actually 3,500. So you have to have that deficit to lose 1 pound of fat. So obesity, again, kind of happens when your caloric intake, you get calories from the food that you eat, from the drinks that you drink, is greater than the caloric depletion that you have on a daily basis through walking, through exercise, through daily activities. So when that's off balance, that's what causes obesity. So let's talk about kind of how we manage this and what we can do going forward. So the first thing would be diet. Do you eat out a lot, or do you have a lot of fast food?
I mean, I eat out every day.
Okay, so that's one of the main things that we tell patients that they need to cut back on. That's kind of a first starting step. It's nice and better to cook your own meals so you know the nutrients that you're specifically getting. I'm going to mention 2 diets today. One would be the DASH diet, and one would be a Mediterranean diet. Those are just really high in fruits and vegetables, whole grains, and some meat products. And then you want to stay away from red meat, sugary drinks, and just sugar kind of in general. So that would be what we would, kind of want you to follow going forward. Do you think that's something that you can try to incorporate in your daily routine?
Yeah, I think I would. Yes.
Okay, good. And then what about exercise? Are you exercising?
Apparently not enough.
Okay. So what we would recommend for exercise is 3 to 4 times a week, a half hour each time, and some moderate intensity workout. So that's what we would recommend, and that can be walking, that can be running, that can be boxing, or lifting weights, kind of whatever you think is best. I know that you mentioned you had a dog, so even taking the dog for a walk can be added towards those. Normal daily activities can be added, to that 30 minutes. So diet and exercise, do you think that's something that you can kind of start out with?
Yes.
Okay, so I think that's a good stepping stone. There are a couple other options down
Yes,
the line.
I would love to know about the other options.
Okay, so there are a few medications that you can take, for obesity, and these are things that are going to suppress your appetite, not make you as hungry, and then things such as decrease your fat absorption rate. I don't want to start off there. I would like to see how you do first, kind of managing it by yourself before we jump to other options. And then, down the line, there are things such as bariatric surgery. It's not an option for you at this time because those are more things for people who have, high blood pressure, diabetes, multiple comorbidities, as well as obesity. The two main ones that we have is gastric bypass surgery. That's when your stomach is created a new stomach pretty much, and it connects to your small intestine. So in that stomach, it shrinks in size, so it allows you to have less food and you feel full after that. And then the other one is called gastric banding. So when a band is literally put around your stomach so you're constantly feeling full and so you're not wanting to eat in excess. So overall, I think this has been a really positive discussion. We have gone over a lot of information and I'm sure it's a little bit overwhelming, but I think some stepping stones, diet and exercise are number one. So again, you're going to want to do the DASH, your Mediterranean diet, not to eat out as much and start cooking your own food at home. And then exercising 3 to 4 times a week. Those are your main goals. And then again, I would like you to get your lab work completed so we can make sure we're not dealing with any other, risk factors and complications from obesity. And then to maybe follow up with a dietitian. Dietitians are great because they can really dive into what you specifically need, what nutrients you need, what works best for you, as far as what you're able to cook, what you're not, and what you can afford as well. So that's a kind of a good connection to have, and he can work with you to meet some goals.
Great.
Do you have any questions for me?
No, this has been really helpful.
Okay. All right. Have a good day.
Thank
nice
you.
meeting you.